Here from St. V's. It is always so nice to have you in studio this time.
In the studio.
Thanks for being here.
Yeah, thanks for having me.
Well, we're here to talk a little bit about sleep deprivation, and that's something I'm really going to hone in on this morning because that's a typical thing that we on this particular shift, and anyone who works overnights often probably feels. Other people probably do too.
Absolutely.
Talk to us about that. I mean, what are we looking at when we think about sleep deprivation? What is that?
Right. Well, you know, they say for adults, and you can look at the chart for different ages, but for adults, we're supposed to get at least 7 hours of sleep per night.
Okay.
8 would be awesome.
Yeah.
I think all of us, you know, I look back in my years as in college and medical school and residency and think of how much sleep deprivation I really had and how dangerous it really is. And, you know, I want to encourage people watching this who happen to be students not to pull those all-nighters, not to, you know, it's not better for your brain the next day to do that.
Yeah.
You're not going to concentrate as well. You're not going to remember things as well. And then as adults, just when we do have bad habits of staying up too late and I'm the one that gets things done after the kids go to bed and then end up, you know, sacrificing my own sleep. It's not good for us the next day in terms of the way our brain functions, our concentration, our memory, but also there are bigger, you know, ramifications of that poor sleep than just our fatigue and our concentration the next day.
It can really impact, I mean, just your overall health, and that's kind of the scary part about it.
Absolutely. So I like to think of the brain as an organ just like your heart or your lungs, and you know, you don't want to smoke because you don't want to have long-term problems with your lungs, or you want to keep your blood pressure under control. But you know, your brain also, if you're not getting good sleep long-term, you can have problems with memory and concentration. And but in addition to that, you can have problems losing weight that you want to lose, or you may be gaining weight and not understanding why because you're not getting good sleep. You may have increased high blood pressure and stroke and heart attack, increased car accidents, obviously as well. So all of those factors that people may not associate with getting poor sleep need to be remembered as well.
Yeah.
Yep.
Okay, so I mean, how can you fix it? I mean, it's so hard to move away from your daily routine. You're often just like, I'll figure it out. I don't need the sleep. I think about that when I have like a small child at home. But really, honestly, there are ways that you can help curb it, right?
There are. Now, there are some people watching the show saying, I would love to get more sleep, but I just can't sleep. And so, you know, that's one category of a medical sleep disorder. And that's where you really need to go and talk to your doctor about, you know, what's going on and what you can do to address that. If you're snoring a lot, or if you have sleep apnea, or if you have chronic pain, or if you're just have primary insomnia. But then there's those of us that are just making poor choices in terms of our sleep habits. And I fall into that category as well. So I get it. But the more we can go to bed at the same time, the more that we can wake up at the same time, even on the weekends, cringe, but it is important to stay on that circadian rhythm for our body. The importance of having good habits before we go to bed, because we may fall asleep, but we're not getting good sleep when we fall asleep if we're looking at our screens, if we're watching TV. Think about even using blue light blocking glasses. Our brain is primitive and it thinks if there's light coming in that it's still daytime, and it suppresses our own melatonin secretion. So it thinks it's not time to go to bed. So the more that you can kind of create a good environment going to bed, don't eat right before you go to bed, you know, control your alcohol, especially right before you go to bed. Exercising right before you go to bed also is going to stimulate your body and give you, you know, poor sleep for the night. So looking at those things will help. And you know, controlling your snoring is another big one that I would like to get out there. So all of those things I think would be good for people to put on their list of their to-dos this year, and think of it in terms of your long-term health as well.
Got to give it a try. Got to really, really try and do it. Okay, some really good stuff. I actually really loved this particular segment because I feel like, you know, changing that sleep schedule has been a little rough. But
absolutely.
Anyway, Dr. Erica, thank you for being here. Thanks for being in studio. We
Thanks
always love having you.
Me. Yep.
All right.
Anytime.
Okay, we'll be right back.